I said earlier that we have deleted, we have erased Sudan from the global picture of the global conflicts.
Well, all eyes are on the humanitarian crisis in Gaza, but closer to home, another crisis is brewing. Doctors Without Borders is warning of a humanitarian crisis in the shadows of the Sudan conflict. Fighting has been raging for over a year, as you just heard, between Sudanese armed forces and the Rapid Support Force. Over 14,000 have been killed and millions have fled their homes. But those that remained in the country now face starvation. Andrew Mews from Doctors Without Borders joins us now to continue to unpack this. Andrew, good morning to you. Thank you very much for joining us here on eNCA. Before we get into the medical crisis that is looming in Sudan, I'm intrigued to get your response to some of the comments by Advocate Sipho Mantula. Do you agree that there's a lack of media coverage of the situation in Sudan?
Good morning, and thank you for asking me to speak today. Actually, I think it's extremely important that I was invited today to speak about this, because I can only but agree with the previous speaker that Sudan is being forgotten, that we are seeing 8 million people living in terrible conditions, some inside Sudan, some displaced into neighboring countries, and it seems to be a crisis that is forgotten.
Now let's get to the medical situation. We are hearing reports that doctors are actually on the brink of stopping all activities unless supplies arrive. Please help us by sketching the picture.
So MSF works in 10 states across Sudan. We're in Khartoum and we're also in Darfur. We also work across the border in Chad, where 1.7 million people are seeking refuge. What's really clear is actually getting supplies into Sudan has become more and more difficult. It's been difficult from day one, which of course this war started a year ago. But now we see getting supplies into the Red Sea ports extremely difficult. We run a trauma surgery ward in Khartoum, which is a scene of very heavy fighting in and around the city. And actually, we're almost running that trauma surgery ward on a month-by-month basis. We are struggling to get supplies in that will last longer than 4 weeks. Every month, we have to reassess, can we continue for the next month? We become quite innovative in bringing supplies in. But clearly, there are political blockages to bringing in supplies and also actually bringing in experienced international staff who could help surge in capacity and run some of these clinics. But these visas and administration issues are also blocking our ability to deliver aid.
Let's unpack those political blockages that you are referring to. What exactly are you talking about?
So visas for international staff, we have a team of humanitarian experts made up of doctors, nurses, logisticians, even water and sanitation people, which is very desperately required. We would like to surge in bringing extra capacity into the country to deliver much needed life-saving care. But actually visas are blocked. The government is restricting access, is restricting the ability to bring people in. At the same time, supplies are also held up at the borders, both on the Chadian border and on the Red Sea border, making it extremely difficult to deliver care.
I want to get to what you think some of the solutions are, but very worrying as well, Andrew, is the fact that food distribution in some areas have also been affected.
Yes, we are extremely concerned about rising rates of malnutrition. In one of the displaced camps where we work, we see a child die every single day from starvation. Clearly, because of the huge amount of displacement, we're talking of 8 million people, and many of those of our patients speak about their houses being destroyed, whole villages being burnt to the ground. And of course, this means the community's ability to grow food, to access food is severely curtailed. And actually, humanitarian actors really need to ramp up their ability to deliver care, including food, actually. And there is higher and higher rates of malnutrition that we see every single day.
What are some of the medications that are really critically low at the moment that's posing a big risk to the lives of the people of Sudan?
Well, we talked about surgery and bringing in necessary surgical supplies earlier. Certainly, that's a big need in Khartoum. But actually, if we look at where we're working in some of the internally displaced camps in Darfur, what we really are concerned about with now is malaria. Malaria is one of the biggest killers of children under 5 in normal times. When you have such huge displacement where people are living under plastic sheeting and the rain's just about to start, we are expecting to see a huge increase of people affected by malaria. And undoubtedly, that will cause higher mortality in children under 5. So malaria medications, bringing in bed nets to prevent malaria is really necessary and something that we hope to, again, surge in capacity over the next few weeks.
Let's then now talk about solution. What do you believe is the solution to try and get residents the aid that they need in Sudan? What's the role that you think the United Nations should be playing, etc.?
Well, we would really like to see the United Nations and actually the wider international community start providing some leadership on this crisis. We really need to scale up massively humanitarian assistance. And we also call on all parties of the conflict to respect international humanitarian law, ensure safe access, allow humanitarians to come into the country, but also to stop blocking supplies, because we also need that to happen. What we're really lacking, if I'm honest, is there is a gap in moral leadership when it comes to Sudan and the crisis we're seeing at the moment.
Just briefly, Andrew, do you believe that Africa as a continent is paying enough attention to this crisis? We do see a lot of attention from our continent going towards the Gaza Strip, for instance, and Ukraine. But do you think we're paying enough attention to this?
Not just Africa, I'm afraid to say. I think the world is not paying enough attention to Sudan. We're talking of 8 million people displaced. That's actually 4 times the number of people displaced in Gaza. And it's lacking to being on the media. There aren't enough countries in the world speaking about it. And certainly we would want to see more and more states like South Africa prioritize dealing with and finding a diplomatic solution to this current crisis in Sudan.
Well, thank you for helping us to shine a light on it this morning here on eNCA. Andrew, before I let you go, can you help us understand the current mental state of some of your medical staff in Sudan? I can just imagine from what you've described that they must be absolutely fatigued at this stage.
I mean, you're right. I spoke about the difficulties in bringing international staff and trying to rotate our humanitarian teams in and out of this crisis so that people get respite. Actually, I didn't even mention our locally hired staff. 90% of the people that work in our clinics are hired from Sudan. And actually, these are people that are witnessing firsthand the conflict. Many of them are victims and survivors of the conflict who have been displaced themselves, and actually just living in a conflict that's been going for 1 year now, where people are displaced from homes, where villages have been burnt down, and trying to deliver care when at times it feels like we're on our own in the country delivering healthcare. It's just a terrible mental strain, and it's something that we as an organization will have to invest in trying to support our people as they respond to the crisis.
Well, Andrew, thank you very much for the incredible work that you do and helping us to understand this crisis a bit better this morning. That was MFS Southern Africa Executive Director Andrew Mews. We now stay on some news from the continent. Zimbabwe's new currency, the ZiG,